Hey, good morning, everyone.
Good morning,
Good
CJ.
morning, everyone.
Wait, CJ, hold on. It's preparing. Hold up. Thanks, Charlie. Okay, I think we're ready.
Are you gonna
John
recount?
Ask him what? John Strope, if it's, ready. Is it ready, John? No, it's still, hold on, y'all, it's ready now. Now you're live. You said it's ready. Okay, we're ready.
And good morning, everyone.
Morning, CJ.
Today, April 28, 2020. This is our pre-meeting, and we're going to be now in the capable hands of City Clerk, Ms. Lisa Lambert.
This is the pre-meeting of the Mobile City Council, Tuesday, April 28th. We have approval of minutes from April the 21st.
Good job.
Ditto.
Done. Hang on. Okay. Okay. Thanks. Essential COVID-19 items held over. 08301. Approved purchase order to Donahue Chevrolet for 14 police package SUVs and for 26 police package SUVs.
I have a question. And
Chris?
it's we have 26, 40 vehicles. About 1.3 million. I want to know, is this money coming from the budget, or is it from a grant that we received from the feds?
I can answer that. This money is from the budget. So
Okay.
these funds are accumulated on a monthly basis from the lease rates that are in the budget. So there are no matching federal grants for this.
Well, I have a concern with the mayor says that we on a normal month we would take in 24 million. We're taking in about 12. So we know we're losing money, and I'm wondering is this the time to start spending money on vehicles when we don't know what the future is? I think this is not a good time to be spending millions of dollars on. This is not last week we had them up there. Almost every week we have these Tahoes up there, and it's not going to help us with the economy. I think we need to be trying to conserve, and I don't think this is the time to do that. What's that?
Okay.
Madam Clerk?
$08304 approved purchase order to Vulcan Inc. for various signed stock items. 08306 approved purchase order to Beard Equipment Company for 2 used John Deere ProGator utility vehicles. 09307 reallocate monies from the 4-cent gas tax to the G Tiger 16 grant fund to fund local match portion of the roundabout at Broad and Canal Streets.
And I believe that, Madam Clerk, I believe that we did get an email from the administration on the balance of that 4-cent sales tax. Did everyone get that?
Yes, and I asked another question about what's still in that fund as far as we got the balance, like you said, but I wanted to know what other programs have been, road improvement programs have been allocated in the last 4 years out of that funding source. Because this is the first time in a while that I've seen that line fund actually go towards a project. So I wanted a refresher, so to speak, on how much has been spent in the last 4 years from that account. And apparently it was turned over to the right department people, and we'll get that as well.
It's
And-
coming. I can
Correct.
tell you in general, it's being funded. It's being funding the pay-as-you-go projects, such as the last Hillcrest that was resurfaced, all the active pay-go that is going on now, all the design and CE&I work, and primarily these large capital projects. But that list is being put together. Should have it by close of business today.
Appreciate that. Thank you very much.
Oh, look straight on. Who?
Good morning, Mr.
Oh.
President.
Good morning. Had some technical difficulties, but I'm here. Good morning, good morning, good morning.
Good morning.
21309, authorized contract with Complete Management Group for right-of-way mowing of Hillcrest Road, north and south sections, and Cottage Hill Road. 21310, authorized contract with Neil Schaefer for O'Shell Road and Upham Street signal design. 21311, authorized contract with Micor Inc. doing business as MDS Construction for Spanish Plaza hardscape repairs. Those are all the held over items. Essential COVID-19 items. Presented for the first time, 08313, approved purchase order to PKJ International LLC for nano dismounted X-ray system, $47,545. 08314, approved purchase order to Doc RX for COVID-19 test, $36,000.
I have some questions about that one. This is for another 3,000 tests of antibody screening for COVID. And I've had some people contact me about the validity of those tests. And I also wanted to know where these other 3,000 tests would be placed. So if the administration could give me some more background on that.
Jim on the line.
Yeah.
Walked out. Yeah, he walked out.
And
We did 6,000 tests last week of the antibody tests. So
And
do we have some more? Well, it's a first read. It's under 50,000, but we can hold it up till we get some more information on exactly what those tests, where they're going to be done, who's going to administer them. And since that would be quite a total of these type tests within our city. So we need some more information. At least people who have called me, they're also concerned that it's not FDA approved and also has a false negative of about 20% of those tests. So just would like some more information from the administration on this. Thanks.
And I've also I've talked to people about that too. And it seemed to me that the accurate test is the PCR test. It's where to put the stick up your nose, and it's accurate. It's not beating around the bush. They can tell you up front what the situation is, versus the antivirus test. Like Beth said, it's about 20 to 23% of them come back false. So why are we not using the PCR test?
Ladies and gentlemen, Director Barber is on his way, I think. I think he's coming in here. And we can answer some of your questions about the FDA, but he can talk to you about the administration. But we are using the PCR test. I don't want anybody to believe that that's not true. We are at all of the testing sites that are drive-up PCRs are what being used, and it's not anybody from the city that is administering. It'd also be important to know the people that call you, were they're from the medical community?
Well, the calls that I got,
Yes,
Attorney Woods, were from the medical community. They saw the
Thank you.
item and were concerned, not necessarily that the city was involved in procuring tests, but the type of testing and the effectiveness of the testing, the high level of results that were mixed, that were associated with this particular type of test rather. So I certainly would appreciate some more information in favor of testing. Don't get me wrong. I just want to ensure that where we're expending resources, we're getting the best type testing for the amount of money we're expending.
Yeah, and
President, Director Barber is here now, but I think it would be useful for Ms. Rich to re-ask her question.
okay, thank you. I appreciate that. And I have gotten calls from the medical community on what they've read about the antibody test. This will be the second phase of a request for, I guess, a total of now 9,000 of these antibody tests that the city would pay for. And so I was wondering, I know you talked about all the first responders and medical community, but it has a high failure rate and it's not FDA approved. So we're promoting that we're testing, but it's not quite the test that perhaps needs to be on the ground here. And I know you're doing those, the proper swabbing at the 2 locations that I'm familiar with. And I imagine it's also at the health department and other resources for that the city didn't participate in. But you've got Hillcrest and then you have LAD. So, and those people need to be symptomatic before they're tested, if what I'm reading is correct. But again, 9,000 of these antibody tests, I'm just really curious because of all the questions that I received. When we need PPEs like masks and gowns in nursing homes and perhaps even masks for retailers that they could purchase, but at the government price, if depending on what the governor says about opening our businesses. So it's really the use of the resource and the credibility of the resource. Thanks.
All right. Yeah, Ms. Rich, the antibody testing or the kits that we've been purchasing, I guess to tell you how it's actually being used, they're not FDA approved as a diagnostic tool, but they're not being used as a diagnostic tool either. They're being provided to the first line medical providers, the doctors and the nurses that are doing the PCR testing, which is that nasal swab you keep hearing about. The problem is, and you are correct, that you had to be symptomatic, and then at first you had to have some kind of underlying chronic condition, and so it was very limited testing that we were doing. With the first responders and medical personnel in nursing homes, we used antibody testing to detect COVID-type antibodies in the body, and even though you were asymptomatic, we were letting them go through the PCR testing. And we were able to identify by doing that people that were carrying the virus but had no symptoms. And so we're not using it as a diagnostic tool, and there are some limitations to it as far as there's a crossover possibility that it's picking up other corona-based viruses that are not as deadly as COVID-19. And so we understand that, but what we do know is that it will pick up COVID-19. We know that for a fact, and we've done that time and again. And to tell you a little bit about how we proceeded, when we received the first donation for first responders, we took it out to Diagnostic Medical. Dr. Kobe Harrison took it and then began to field validate whether or not the antibodies would accurately pick up COVID-19. And they did that by bringing in acute symptoms of COVID-19 that were confirmed positive cases and tested for antibodies. They brought in those that had recovered and tested for antibodies, and they brought in people that they knew did not have COVID-19 and tested for antibodies. And so they were able to validate those tests. And we continue to validate them. Like if we get a different brand in because of availability, the University Hospital right now is validating another one, and they're doing it exactly the same way against known COVID cases. And so we were able to use it for mass screening. I think the best example would probably be the Metro Jail. We took all the CROs and ran them through the antibody testing, and then if they had the antibodies, we put them over to the PCR testing. And I'll tell you this, it picked up 18 people that had COVID-19 but were asymptomatic. So we were able to get them out of that jail as quickly as possible. Now, we still have problems with our jail because we've not tested the population. So we're working with the sheriff on trying to figure out how to do that. But I guess the key aspect of why it has helped us is we've been able to remove police officers and firefighters and corrections officers and first line medical personnel that were asymptomatic carriers of COVID. And if we hadn't had the antibody testing, there was no way for us to know that. And I'll be glad to answer any more questions for clarity.
I would just add this, that the Mobile County Health Department is currently testing all of the inmates in the Mobile County Jail, and they're using the PCR, not the antibody test.
That's something we're still working with them on, but we have not done PCR testing of all the corrections officers or the inmates yet. And so we're working on that, but you're talking about 1,100 inmates and a couple hundred of the corrections officers. And I was on the phone with the sheriff yesterday trying to figure out how do we execute on that and not exceed lab capacity to where symptomatic people are also having to need these tests.
I have a question about the failure rate of those tests at 20%, which means you have a population that you've tested, you get a comfort level. How often are you going back to retest?
On the positive cases, and I'm not sure what you're calling a failure.
It's
so
when
maybe
when they are positive, but it comes back as they're negative. And that's about 20% of the testing that's going on with the antibody. That's the problem with it.
Well, again, it's not used as a diagnostic tool. And just because you have the antibodies doesn't mean that you're contagious. And so when we say that it's negative, we're saying that you're not contagious, but you do have the antibodies for a corona-based virus. Now, it could be COVID-19, it could be the summer cold. We don't really know. That would take more extensive testing. But what we do know is it will detect COVID-19. And now once they go positive, y'all remember when they first came out with the CDC guidelines, they told us to quarantine for 14 days. And then if you're asymptomatic, you can go back to work. What we're finding out is the 14 days was not adequate, that on mean average, they're going at least 3 weeks contagious. We've got one nurse that went 41 days before she came back negative on PCR. So that was why the earlier attempts to control the virus failed, is because we were actually sending people back into the workforce that were still contagious. So what we're doing today that's different is that if you get a positive on a PCR test, is that every week you're retested until you get a negative. And if you're a first responder or a medical person, you have to get 2 negatives, double negatives, before they're returned back to the workforce. And so we've learned a lot, I guess, in 6 weeks, but we learned that the early attempts to control the virus failed. And do look at antibody testing as nothing more than a screening tool. That's it, not a diagnostic tool. So we're not telling anybody that they've been diagnosed with COVID-19. We're not telling anybody they're immune to COVID-19 because they have antibodies. We're merely using that as a way to get asymptomatic people tested during a time when only symptomatic and severe symptomatic was being tested. And that was to stop the spread is the main reason. It wasn't for treatment. It was just to stop the spread of the virus, especially with first responders and medical personnel, because they're in direct physical contact with the public, and we wanted to make sure that we were getting them out of the workforce until they recovered.
Are the last week's tests, which were 6,000, are they on the ground now being utilized? And when will this 3,000 come to the city?
There are in stock probably about 6,000 kits. Again, whenever we get them in, there's a validation that goes on. So USA Health Systems is validating the last shipment of kits. In other words, they're testing them to make sure that they function as designed, because there are, just so you know, there are bogus scam kits out there. And so
Yes.
That's why we have to go through this testing process. So they've been on the ground for about a week. They should finish the field validation today. And just so to give y'all some level of comfort, you know, we did a conference call with the USA Health Systems. It was the CEO, the CMO, epidemiologist, as well as a molecular biologist, and went over all these procedures with them to make sure that we're using them properly, because they have been used improperly by other cities in diagnosing people or telling people they were immune. And so, but that's not what's happening. And I'll tell you what is probably going to give you the best information is that everybody that gets this antibody testing now has an informational sheet that's given out by USA Health Systems or Diagnostic Medical, explaining exactly what the COVID-19 antibody test is and that it's not diagnostic, and you know how that is followed up on. If I send y'all that, it's a one-page explanatory letter. I think it will clear up that we're not misleading the public here, that we're making sure they understand that this is not a diagnostic tool. The only diagnostic tool approved by the FDA is what Councilman Richardson referred to, the PCR test.
The swabbing of the nose for the virus, right? Okay, if that would be great. We don't have anybody's personal information, but just what the form looks like. I would like to be able to send that to people who have questioned the validity and the reason why the city's doing this. So I appreciate that. Thank you.
If I may, Jim, there was a 20% number thrown out there. Part of my question is, what do you believe that false negative is? And the other part is, what about the swabs? Is there availability in the foreseeable future so that folks who want to can pay for a test and or use their insurance to pay for a test?
I mean, yeah, good question. You know, there's still, it has to be by physician referral. It still is, you know, before the insurance will even cover it. So if you're asking me about capacity, and here's why it becomes difficult, the only laboratory south of Birmingham is Synergy, and that's here in Mobile. And their capacity is about 800 per day. And so you can see how we could quickly exceed that capacity, because they're not just doing the city of Mobile, they're doing the region and the state. So when we talk about mass testing, the capacity is not there. LabCorp, which is the national laboratory, can only do 12,000 a day, and that's for the entire country. Now, all of the labs are trying to pick up capacity, and so we expect Synergy to be able to go to 2,000 a day by mid-May. And so as everybody comes online, our capacity will continue to go up. And that was by design. You know, a lot of what we did with the shutdown was to slow the virus until we could get capacity up. Because I'll tell you, a month ago, we didn't even have the capacity south of Montgomery to do anything, south of Birmingham. And the only lab in Birmingham was overwhelmed by the Highland Church. And so that's why it was taking a week or 2 weeks to even get a test back. And so we are doing next day turnaround. But it's a good question, but that's why the antibody screening, for now anyway, is important, so that we're not overwhelming the lab with asymptomatic testing. And to go back to your question of what I guess false negatives is what you're referring to, I don't know that I could say they're false negatives. What I can tell you is that about 12 or 13% of the population that we tested last week during the peak had positive antibodies. Out of the 12 or 13 positive antibodies, and keep in mind, that doesn't mean you're infectious. It means that you either had COVID or a corona-based virus, possibly, you know. Out of the 13% that had positive antibodies, 22% were active carriers. So again, and those were mainly correction officers coming out of the sheriff's department. So has it been valuable to us as a tool to get asymptomatic carriers out of there? Yes. And I don't know if CDC's released some of this. What we're finding out is mild symptoms, headache, loss of taste or smell, or diarrhea, nausea. All of those have now been added to the list of symptoms so you could have had a headache one day and not realize that you were infected with COVID-19, because we were all originally told shortness of breath, fever, and cough, and now they're adding these less severe symptoms. And so, you know, you might have had an upset stomach one day and not realized it, but you're actually a carrier of COVID-19. I can tell you that Jim Barber's not diagnosing anybody. I'm not pricking any fingers. These are medical personnel on the front lines that are seeing people that are doing all these diagnoses, and they are being seen by a physician if there's a positive antibody.
Roger. Thank you.
Yeah, I do have a question, Director Barber. And, I also have received, some calls as later this morning, talking about the test. My two questions is that one, is it possible that we can get some type of data clarifying, has there ever been or found of the negative test that came back, said that it was negative, but that actually was positive? Because I also have received calls about that also. And second is that, have the city, do they have any PCR tests on order?
Okay. Can you have a negative antibody and still be positive PCR? Yes, you can. Again, it's a tool. It's not a diagnostic tool. So just because you test negative for antibodies does not mean that you do not have COVID-19. It takes about a week to 14 days before your body develops antibodies to a virus. And so you could be in the earlier stages of infection and test negative. And you have to realize that all of our testing, whether it's PCR or antibody, is a snapshot in time. And so it doesn't mean that you won't go out tomorrow and get infected with the virus. And so it doesn't mean you're immune. It doesn't mean that you don't have it. And so are there drawbacks? I mean, there are limitations to what antibody testing, there are limitations to what PCR testing can do. And I'll tell you this, that one of the things talking to the USA Health Systems is that they've seen a case where we brought, remember the double negative I was telling you about, where we brought a COVID-19 symptomatic person in and they swabbed and they got a negative swab. And so they did the second swab 24 hours later and it came back positive. So there are no fail-safe testings. And we also had another person, it was a first responder, that's tested positive 3 weeks in a row, but has not developed antibodies. And so, can we explain all this? I will tell you that 90% or better of the time that, it has been effective in at least picking up the COVID-19 in the more advanced stages to where there's antibodies present, and then we're able to confirm that through PCR swabbing in conjunction with the antibody test so that we can look at antibodies that they are positive. So everybody that's coming in to be retested with the PCR gets an antibody for us to validate the antibodies that we're using. So, but we don't have a fail-safe test. Even the PCR test is not a fail-safe test.
And again, I think that the concern is that, where I talk to some people, is that the drawback is that the persons or the citizen get tested with the antibody, they get tested negative, but they're actually positive for COVID-19, and they go home and thinking that they are negative, but they're actually positive and spread it at home. But my second question is still, does the city have any PCR tests on order?
As far as your second test, no, sir. We have not ordered PCR testing. That's a laboratory kit. It actually consists of a medium and a swab that's used in order to collect the sample that's sent to the laboratory. We don't have to purchase those because they're provided by the laboratories or the hospitals. They're the ones. But that early on was the big problem, is that those kits were unavailable, and so we were unable to do testing because we couldn't get the kits. But now the capacity is there for the kits, but they're supplied by the laboratories to the hospitals.
Is there any type of data? I mean, as far as in the questions that, some of us have, I mean, is there any written data that's out there that can be shared with the council people?
Yes, Los Angeles County, as far as antibody testing, Los Angeles County did the public. They basically went out into the population and did about 600 people with antibody testing. And so I'll forward you that study on how antibody testing can be used to look at the spread of virus in a mass setting, where you have thousands of people that you're wanting to test. I can send you that, and I can send you the informational sheet on what we're giving out to people that are taking the antibody test. And keep in mind that not as a diagnostic tool, but just as a screening tool to be able to find asymptomatic people that are carrying the virus that are contagious.
Jim,
And so
I think there really needs to be some kind of 101 on this, kind of very elementary, but I think we're all kind of missing it. And I did until I heard it on Friday about capacity and about laboratories and about turnaround of the kits. It's no longer about, is there a swab available, but can we get the results? And in an effort for us to get a result on an asymptomatic person who wants to pay for it and is demanding to have a test, it gets in the way of the person who is symptomatic, who is in one of the categories that is at risk. And so the lab has to do a triage, a prioritization. And maybe we can get some wording with that we can all put out in a newsletter that kind of says, this is the issue with testing, and it's not necessarily about swabs or who gets them and who doesn't because of who they are and who they're not, or, that kind of thing.
Yeah, and again, they're screened by medical providers, so there's a telephone triage done before they're brought in for PCR testing. And so maybe I can get that screening questionnaire and get that from the University Hospital and disseminate it so you know what kind of questions are being asked in order to screen. The other ones are those.
How do you talked about, though, that elective surgeries are going to start up and that hospitals are going to be loading the labs down, as well as symptomatic tests are going to be creating an additional demand for the labs. And maybe you can walk us through in a few sentences on that piece of paper about the lab capacity and how they are going to handle that and what's going to put demand on.
What I'll do is get maybe a one-page white paper from Synergy Laboratories on what their capacity is and how elective surgeries, and it's not, John, it's not just the elective surgeries that's really impacting the labs. It's the outbreaks in the long-term care facilities, because they're doing, the suggestion is do mass testing in the nursing homes. And I don't disagree with that, but there's over 4,000 beds just in the city of Mobile. And so you can see where we can exceed lab capacity. We have to be very methodical about the way we do it, because we don't want to end up in a situation that we were in at the very beginning of the outbreak, to where it's taken 2 weeks. If you could get a test, it was taking 2 weeks to get a result.
Right.
And,
Mr. Hey, Jimmy?
Yes, Gina.
Just talking about the capacity, as we will probably start phasing in some reopenings. We'll find out more at 11, I'm sure. But people continue to criticize the idea of reopening anything, really, if we can't do mass testing. And I'm visualizing what they think is that everybody should get in line and get tested over and over before we ever reopen anything. So talking about capacity, how do we explain to folks that we can't do this just overall mass testing of everybody in the city, everybody in the county at one time or over like a week? There's got to be a way to explain why we can't do that, even as we roll out maybe some phased reopenings. We just need to be able to explain that to people, because we see it all over social media.
Yeah, and that's pretty difficult. It's the same reason they're unable to do it anywhere else in the country. It is a capacity issue of the laboratories. I can get y'all something from Synergy, but I'm not sure that the public really understands. And do take this in consideration, that when we take PCR testing, any test, all we're doing is taking a snapshot in time.
Right.
It could change immediately after they walk away. And so, how do we, and a lot of people seem to think the test itself is some type of cure or immunization against, and it's not. It's really just diagnosis, that you have COVID and not the flu or, the summer virus. But I'll try to get y'all as much information. I'll send you the Stanford study of LA County about antibody testing, which is the only alternative. We can run thousands, or we have ran thousands of medical and first responders through the antibody testing, and it was the only way that we could screen for asymptomatic. It's impossible to do everybody on the PCR testing, because I'm telling you that the capacity of the lab here is 800 a day, and that's not just for the city of Mobile. And Assurance Laboratories up in Birmingham, I believe, has a 1,000, maybe 2,000 a day capacity. But we should be going to 2,000 a day. So we will increase our testing of asymptomatics as well as symptomatics. John Williams brought up a good point. With all the hospitals coming back online with electives, they're testing asymptomatic patients before they bring them in for surgery. So we're slowly doing a lot more without exceeding capacity. But how do you tell, hundreds of thousands or millions of people that they can't be tested right away? It's just, the capacity is just not there.
Mr. President.
Thanks.
Mr. Davis?
Yeah, thank you. I think this has been a good discussion. I just want to reiterate that we are in a place we have never been, going down a road we've never been before. And we're having to learn it as we go down this road. And as we attack this issue, we don't have a scalpel. All we have are blunt instruments. And one of the blunt instruments we have is the antibody test. And it'd be wonderful if it could be more directed, it could be more specific, it could be more accurate, it could be all these other things, but it's not. But it's one of the tools we have right now. And until we get a little bit further down the road, it's one of the tools in the basket that we have to use. I think continue to have, and in these meetings we have reinforced, and Dr. Eichhold has reinforced that if you think you have the virus and you go, there's this belief out in the public that if they get tested and it shows they have the virus, there's something that can be done for them. And the truth is, if you go out there and you test positive, unless you're having trouble breathing, they're going to send you home, because there's no treatment for this virus. They can treat the symptoms, but they can't treat the virus. And that's, Director Barber, that's one of the things we need to continue to reiterate to the public is the PCV test is a test that helps government and health professionals manage the response. It's not going to help the person who actually receives the test get better any more quickly. Thank you.
Mr. President.
Davis, you're absolutely correct, and that's what I was saying, that everybody seems to think that testing is either the cure, the treatment, or the vaccine for COVID-19. It's nothing more than a diagnosis, and there is no treatment, there is no vaccine, and unless you need a ventilator, they're going to send you home. And some are being sent home with oxygen, just to keep the ICUs open.
Mr. President.
Yes, sir, Mr. Vice President.
I have a question for Director Barber. And Director Barber, from my office and myself, I really do appreciate everything that you all doing. Really do appreciate it so much. But just the concerns as in phone calls coming to me, that people asking me questions and I got to find answers for them. The current antibody test that we're receiving is not FDA approved. Are there any antibody tests out there that are FDA approved that can probably just give us a more accurate testing versus the ones that we are receiving today? No.
There are no rapid serum tests or these antibody tests. And keep in mind, this is kind of like an at-home pregnancy test is what it is. And so there are none that are FDA approved, mainly because COVID is so new to us that the FDA has approved some for use in the U.S., and they've approved all of them for distribution in the U.S. They have just not, but nobody has said that this is a diagnostic tool. It's kind of what Councilman Daves was saying. It's a tool, but not a diagnostic tool. So ideally, when you go into battle, you want a rifle, but we've got a brick, and that's all we have, and it's what we have to use. What I can tell you is that we have been able to screen, diagnose, and remove asymptomatic first responders and medical personnel away from patients and the public And had it not been for the antibody testing, there was no other way that we would have known that they were carrying the virus. And I mean, dozens and dozens we've seen that we were able to quarantine to keep them from spreading the virus. And really, that's all we're trying to do is manage spread. It's not cure, it's not treatment, it's not a vaccine. We're just trying to manage spread. And so, you know, how do we go forward? How do we deal with other people that are not in the medical field or first responders, but are in direct physical contact with the public, and hairdressers, barbers? And you saw where we offered some antibody testing to barbers. Again, it's not perfect. I mean, but the only perfect antibody testing will come from the laboratories, and that won't happen until probably late May that we'll have that capacity. And again, because COVID is so new, it's taken a little bit of time for the medical community to be able to do what it needs to do. But that would be 100% accurate testing for antibodies, not that you're contagious. The only way to see if you're contagious is still the PCR. But it will be able to identify people that have the antibodies specific to COVID-19, which can then be used in the plasma where they're extracting the IgG antibody for treatment of people. But so far, that's all that we're seeing, and that capacity won't be here until late May.
I think, so Director Barber made a valid point about the home pregnancy test. I think a number of people, in particular the people in the press, keep harping on something being FDA approved or not. I think that has a different meaning to a lot of your constituents, but just so you all know, the FDA has no objection to the use of these serology tests or these antibody tests that we're using as a screening tool. So screening, looking for antibody as far as diagnostics, saying you actually have the virus. So remember, I think it's very important to continue to make that clear that we're using this as a screening tool, but more importantly, when something is or isn't FDA approved, and I know most folks haven't gone through the FDA process with a drug, but that simply means that it is safe and can be used based on the information the manufacturer has provided. And so this tool hasn't gone through that process, but specifically the FDA has put out guidance saying that there is no objection as long as there are 4 categories that are named, and I can give you the site, as long as you're using this as a screening tool. So the FDA knows that this is used for screening and not diagnostic, and more so anything, it's safe. So it's safe and it can be used as a screening tool, which is what we're doing.
Yeah, and I do appreciate everything, but again, when you getting information, not just from off the street, but from, some professionals saying that the current antibody tests that we're receiving or that we're administrating or buying is false negative. We have to be accountable to the taxpayers' money, and especially if they're supposed to be, quote unquote, some FDA approved antibody tests that's out there that give, that's not known to give as many false negatives as currently the one that we're concerns. One, that the ones that we're receiving, that the one that we're currently buying, is they have a high percentage of false negatives. And 2, my other concerns is the people that get false negative report, they go home and spread it. And those are my 2 concerns. Again, I do appreciate everything that you all are doing, but watching the taxpayers' money as far as them having some false negative reports out there, then going home and people still sharing this disease is very concerning to me, But I do thank everything that you all are doing.
Well, Mr. President, let me offer y'all a tour of the Ladd Stadium site and to meet with the medical personnel from USA Hospital and look at how we're using this particular antibody rapid serum test. But ask your questions to the nurses that are using it, the doctors that are using it, and see how they're using it. Because I want to debunk any theory that the city of Mobile is diagnosing anybody or that Jim Barber's pricking fingers. I'm not doing that. These are really just being supplied to our frontline medical personnel that are fighting the virus. And if we were able to remove dozens of first responders that were in contact with the public, dozens of them, through this particular procedure, I'd say that was tax money well spent, because those were carrying the virus actively.
Any other questions and concerns for Director Barber on this particular subject matter?
Yes, Mr. President.
Mr. Richardson?
I just want to say, as long as our leaders say, in conversing with the public at news conferences, that we are testing, the citizens is going to continue to believe that the city of Mobile is involved in testing. As long as the word "we" are testing in the state where we are testing, they're led to believe that our employees are under the tent testing the people. Instead of saying we have provided tests and the state who are actually conducting the testing, that's not what's being said. What's being said is what we are doing, and the citizens are led to believe that city employees are conducting tests.
Any other questions? Concerns? Hearing none, Madam City Clerk?
08315, approved purchase order to CDW Government LLC for Microsoft Exchange and Microsoft Power BI Pro annual licenses, $207,005.50. 09316, reallocate $8,651.23 from capital project engineering right-of-way and testing to 2019 bridge and culvert repairs. 09317, reallocate $28,611.57 from capital project miscellaneous citywide drainage to 2019 bridge and culvert repairs. 09318, reallocate $88,985.55 from capital project 2019-2020 biannual bridge inspections to 2019 bridge and culvert repairs. 21319,
I have
authorized.
some questions about that.
Okay.
That's okay. Is Nick Amberger still on with us?
Yes.
Here, I'm here,
Okay.
Bess.
Right. Do we have the list of all the different locations? Because we're rearranging the funds, but don't know where they're going to be expended. So can we get that as well, please?
We do. I can provide it. It's 17 sites, either 2 or 3 sites in each district. And what we're doing, this project has CIP funds in it, and we're trying to supplement it with these additional funds that are from leftover efforts so that we can make the entire budget whole before we route the contract. We took bids back in April.
All right. But if you have the projects identified and the resources that are all going to be put together, it would be great if the council could have that as well. So I appreciate that.
I just haven't had a chance to send it to you yet. I just got that this morning.
Okay. Thank you.
21319, authorized contract with McCory and Williams to perform engineering services for 12 Mile Creek Bank stabilization, CLOMR and LOMR studies, $35,000. 21320, authorized design contract with Volkert Inc. for a roundabout at Canal and Broad Street, $30,378.
Well, most of that paid by Aldott.
Yeah, the city's portion is $3,037.80. 25321, accept permanent drainage easement and temporary construction easement from Sterling and Maria Thistlewaite for Cottage Hill Road culvert repairs at Milkhouse Creek. 25322, grant an easement to Alabama Power Company to provide service to the new fire station on Museum Drive. And appeal, we have appeal of Buzz Jordan on behalf of Cabana Royal, 401 Dolphin Street, concerning the Planning Commission's denial of their application for planning approval to allow an occupancy load of over 100 in the downtown development district.
I think we all agree that that's going to be held over to this, at least the second live meeting, whenever that is. So we probably ought to go to the 12th if we're going to start meeting next week. At least go to the 12th, and if all parties are agreeable, then we continue with the. That's my thought.
Seems right.
This is Buzz Jordan. I'm agreeable to it.
Okay.
Thank you.
Thank you.
Presentation of petitions and other communications to the council. We received communications from Reggie Hill. You all have copies of that announcement.
Before announcements, let's decide what we're going to vote on and not vote on, if that's agreeable to all. If Bess is agreeable, and I'm not asking her to be agreeable on the test kits, I'm okay with that part. I'm okay with the reallocations and the 25-321. That's the permanent drainage easement, as well as the grant easement to Alabama Power. So
These are out of the new reads, correct? You're looking at?
these are the new reads. That's
Yeah.
correct.
Right.
John, go over that again.
Starting at the bottom, the District 7 and District 6
Hey,
resolutions.
John, give us the numbers.
Yeah, I was going to. 25, the very, very bottom there, 25-322 and 25-321. I don't know how we're paying for the roundabout portion. If it was capital, I would say it automatically goes as well. I have to assume that that is. So 21-320. Then we skip up to 09-316 through 318. And then it
The
was
316 is the test, and so if we get the paperwork,
no, ma'am. 316
Isn't it?
is the first reallocation.
oh, I'm sorry, I see that. That's
17, 18
314.
are all reallocations. And only if, I'm not even trying to persuade. I'm not sure that we need the test right now, the antibody test right now. And that couldn't wait till next week if Bess's answers aren't, questions aren't.
I would appreciate waiting so that I can get the information out to the people that question the validity, the reasoning. And since we just did 6,000 last week, I don't know how quickly they're moving them, but if we could
I don't
hold
disagree.
off, I would appreciate that.
I do agree.
Can we hear from, I guess Director Barber left, but is there an immediate need for these 3,000?
I would tell you yes, because what we want to do is be able to continue to build up. We're not the only people in competition for buying these. As he mentioned, this is Birmingham on down, one of the very few places that are being able to get these to us. Secondarily, everybody would like to have the PCR test in favor of these tests, but the PCR test is in shorter supply, and those can only be delivered in or dispersed in the clinical setting. So know that. And so we understand that constituents have questions. If you want to be able to have them pose those questions directly to the director, just provide that information. I'll follow up in writing asking for that contact information for those folks. But Director Barber, he stepped out. I think he's trying to get you that information. But what he's getting you is three things. One is the Stanford study. Two, the sheet that the people who are taking the serology or the antibody test, and then the follow-up information. And so that information he'll be providing to you. But if you all see fit to go ahead and hold it up, we just want to let you know that we do need those tests. So and understand this, that part of what the governor has talked about in reopening is testing capacity. So there's the 14 days in the testing capacity, and Director Barber just walked back in, but the question was, do we need the 3,000 tests moving forward? And that was
Right now.
Yeah. The question is, does this have to be, what is the immediacy of acting on that this week?
What I think you're acting on is the payment of those kits, not the purchase, I think, isn't it? Huh? Didn't we already receive those 3,000?
Jim, I don't.
Oh, so they're already on the ground here?
I think they are. I think.
Yeah, I think those are on the
So
ground.
we're after the fact. Okay.
So we're not holding up anything.
No, sir, you're not holding up anything other than somebody's paycheck, that's all.
Yeah, 1 week.
Well, that 1 week, I'm sure they're used to being paid at least 1 week in arrears. If that's the case, I wasn't aware that they were already on the ground, but I understand that now.
Yeah, because that doesn't make any sense in that we were supposed to do this in order to get those orders in. But if they're already here, then all my questions are basically moot, except for more information that I could give to individuals who have questioned the validity. So I'd appreciate that, still that information, regardless of whether they're on the ground. Thanks.
So we're gonna take it up today or not?
They're already here.
They're
but
already
I would
here.
like more time
The
to
answer's no.
give this information out to individuals who have contacted me.
Interest, no.
So it's not doing, we heard from legal, the mayor's legal counsel that said we had to put this in to get them, but they're already
No,
here.
that's not what I said. I said if you wanted to hold it up, it's up to you, but we do want to continue to buy them.
I'm sorry, say that again?
We don't want to play that back, Ricardo.
That's not what I said. What I said is.
It kind of
is
sort of
important that we have
sounded
it.
like it though.
Okay, all right, we'll hold it up and for payment. Okay, thank you.
But-
I'll
but
be
I-
holding it up or the council can call it out. Thanks, appreciate that.
Bess, I just wanted to comment real quickly. I know that there's a lot of controversy about it because you've got people in the medical community that don't all agree on the use of antibody testing. I understand that. What I'm telling you is that the university site and the DMC sites that are doing all of these drive-through tests are the ones that are asking for these kits, and so that they can screen asymptomatic medical personnel, first responders, and nursing homes or whatever they. So what we're doing is just complying with what they said they need at these sites, along with, if we can, PPE, if it's needed, we try to comply with that. And so again, it's not Jim Barber testing anybody, it's us just working with these sites to give them the tools they need. And again, I'm offering y'all to come to the site, meet with the medical providers on the front line and talk to them about antibody testing and why it's important to them, rather than me.
Quite impressive.
Thanks.
We appreciate the offer, Mr. Director. I'm a personally decline. I take your word for it. I'm not going to any testing site. I think what we were under the impression was that we were going to approve a contract and then we would secure 3,000 new test kits, or however it worked out. But now that we kind of understand that we've already received it and we're just approving the payment, then I believe we can move forward. We probably could have saved ourselves about 20 minutes worth of discussion had we known that. But it was all informational, don't get me wrong. I learned a bunch, but we probably could have, but that's neither here nor there.
Hey, Mr. President,
Mr.
could
Dave?
I just want to ask Director Barber one, because I think there was a important piece of information that perhaps I hadn't latched onto. What I heard you say, Jim, was that it's not the administration deciding to buy these antibody.
Yeah.
The reason we're buying the antibody kits is because the people doing the testing are asking for the antibody kits.
That is correct. And again, not as a diagnostic tool, just a screening tool, just part of a toolkit that they're using at these testing sites to try to help people.
So we've got medical professionals, and I'm sure there is a dispute in the medical community as to the efficacy of these tests. But right now, we're responding to requests from the medical professionals who are administering our testing organizations for these tests.
We
Correct.
are responding to those that are on the ground dealing directly with COVID-19. Those medical professionals that are on the front line, but what you hear are people from the behind that are not doing it, that might be questioning whether or not we should be using these antibody tests.
You might want
Well,
to
if we
refer
could get the
to the-
paperwork without, anything that's open-ended information, I would appreciate that still, regardless of whether the tests are here, you're using them or whatever. So all that
Do the
information
study
would be
in LA
important.
County. I told
Yeah, I
appreciate
don't think
that.
we should not redo COVID. We've already had that discussion. I think we need to move on.
I second that. Any further questions, please send them over to Director Barber and to Mayor Stimson and Madam City Clerk, if we could move to the next item, please.
We're done.
That's it.
The mayor may want to speak to us.
Mr. Mayor, did you have any commentary during this pre-council period?
Are they familiar with what's going to happen today with the governor and what we may do?
They mentioned, that she is speaking at 11 o'clock.
Okay, so the governor will speak at 11 o'clock, and where we stand is that the unified command, with the county, the city, and the Department of Health, there's a document that we have prepared, a draft document in response to what she says. The first 5 pages of it are introductory in nature. This document is a PowerPoint presentation. So the first, I think it's 5 pages, are introductory in nature. Then the next, I think it's 12 pages, specifically address different segments of our population, like it's places of assembly, it's places of worship, it is parks and recreation, it is the hairdressers. So there's manufacturing. So we've got a page for each one of these 12 areas. So let's say if the governor says nothing about opening restaurants, okay, then on my restaurant page, all we're going to say is that the governor's new order does not address any changes in the restaurants, all right? So if she changes her order 2 weeks from now, we can go in and put in restaurants what the change is. So this document, this PowerPoint presentation, it was created, there were about, we had a couple of city councils there, CJ and John last week, looking at it. But so now it's been approved and vetted by the Department of Health and the county. And I think it's very user-friendly. It's written in simple language. It's to be used as a guide. It is not a legal document, but flow. And so today at 11 o'clock, when the governor now makes her announcement, we will take whatever she publishes or puts out as her announcement. And at that point in time, Joe Snowden, Flo, and others will peruse it, modify our document to sequence it, and then at 3 o'clock today, the Unified Command will make a presentation of what we're doing to align with what the governor has said. We'd be glad to send you a copy of that document as soon as it's completed, but we would ask you to keep a close hold on it because it should be coming out, I think what they call the JIC, which is the Joint Operation Command Information Center. They're the ones who will put it out to the press. So it needs to go to the press from the Unified Command. But you certainly need to see it. But it'll be very easy if some of your constituents call you and say, what about this? You'll be able to go to that page and be able to answer their question. At least that's what we're hoping. So that's where we are.
Mel Simpson, I say that when you're saying to the press, saying to us, I don't think the press ought to be broadcasting anything on the TV that we don't know because the citizens are not going to call you, they're going to call us. We need to be armed with information so we can properly answer their calls.
We'll get it to you, okay? And I respect that. We'll get that to you. Just on another note, we continue to see challenges at the nursing homes, and I'll just leave it at the nursing homes. But there's some real challenges with the number of sick people in our nursing facilities, and that's why I was late coming to this meeting. I've been on a call with Dr. Eichel and Masseria initially. She had to get off the call, talking about the things that we've got to do to shore them up. So just be aware that when it starts is if it continues to grow, it's going to continue to put a strain on our hospitals. And so that's you call these co-confinement areas, I think is what they call them. Is that right, a co-confinement area? So in the co-confinement areas of nursing homes like the jail, that's where we're having a problem. It's not out it doesn't appear that we have any increasing cases to speak of out in the general population. It's not anything close to what it is in the nursing home and jail. So that's not to say that the virus is still not spreading in the general population, but that doesn't appear to be a problem at this point in time.
Mr. Mayor?
Hey, Mayor?
Yeah.
CJ.
That's Mr. Small and then Ms. Gregory.
Thank you. Mr. Mayor, thank you so much for all your hard work and even bringing us to speed with the nursing home. But, I have a concern more than just the nursing homes. My concern is more as into the mobile housing, board, the development like such as Crichton Towers, where we have a whole bunch of elderly people, especially African Americans that live there. Are they being tested, or is there going to be there's an outbreak there? Because when you look at those senior homes like Crichton Towers, and there's a lot of African American seniors that are there, I mean, it can easily spread among, especially their, some of them are economic challenge.
Correct. So I'll have to check on that, CJ. I'll check on that and come back to you, okay? Because I don't know the answer to that.
All right, thank you.
Yep.
Hey, Mayor, my question was about the nursing homes. I know we generally see after the fact when there are a number of cases and deaths in these nursing homes. Are there any within the county that you know of or that you can share with us that have already been identified as being true hotspots where a lot of cases have been diagnosed or there have been deaths related to the virus? Besides the, I guess, 3 that we know of?
No, I don't know of any additional than those 3. But, I don't know that it's completely out in those 3. Although the National Guard went in and cleaned along with ServPro on one of the facilities, that doesn't mean that there's still not, the proliferation of the virus in those nursing homes. So it's still running its course. We're trying to set up to do more testing in the nursing homes. The challenge is that having the staff at the nursing homes. I mean, some of the staff has been sick, so it's just a challenging situation for them. Yeah. But I know that on Saturday, the Nursing Home Association was on call with the governor's office. I mean, so the governor's office, the Nursing Home Association, the nursing home owners, they're all collaborating, trying to control the spread of it.
Mr. President.
Mr. Richardson?
Yes, sir. Mr. Mayor, on Sunday night, I sent you a letter regarding Herbert Street that I don't really want to go into at our 10:30 meeting. Did you get the information I sent you regarding Herbert Street and adding the
curfew?
I saw the email, Fred. I think I sent it to Jim DeLapp to get back to me on it. But I've not followed up other than to do that.
Okay, I would appreciate that you give some serious look at that. They went to the planning commission and made a cry, and they followed up at the council meeting when we put the ordinance on our agenda. It's part of the ordinance that we put to. I have the money for the second one, and they are they're disturbed on that street, and I certainly wish you would let us put the second one down. I have the funds for it.
Okay, I'll find out from Colonel DeLapp where it stands.
President Vanzi?
Yes, ma'am.
Thank you. Mayor, this is off the subject of anything we've talked about other than the storm damage in one of the neighborhoods where people were charged. I don't know if it's been brought to your attention. But citizens have been complaining since it was a tornado that was, I guess, calculated or whatever by the National Weather Association. And so I'm wondering if there's any policy or directive that your office could help with those citizens who were charged for their tree debris and roofing and, you know, parts of their houses that got hit, that they put out on the curb. So I just wanted to ask you that. I know you have a million things on your platter, but that is something that is a concern that is been brought to my attention.
So before leaving last night, George Talbot apprised me of it. And, you know, I think there's a difference of opinion if you talk to the trash department about what was on the curbside. I mean, there were some pictures shown in the media of looked like fresh debris, but we have some pictures of some large trees that were brown, you know, so there's a conflicting stories about who did what. And my comment to George was to reach out to John Peavy and tell him that if there's a pile that we're going to charge somebody from us to take pictures of it so that we don't get into a controversy about whether this is, you know, storm related and so forth. So I am aware of it. I know that we need to do something to not erroneously charge someone, but I don't know that we really did in this situation, but they're checking into it.
Okay, thank you.
Ms. Richardson?
Yes, real quick, I've had 2 instances in my district where they refused to pick up the storm debris. One was that during the night, 2 trees fell across the power line. The Alabama Power Company came out and cut the tree up. And the tree came from a house on one side of the street, but a portion of the tree fell on somebody else's property. So they cut the tree up, placed it on this lady's property. This lady is not the single lady, head of household, don't have a job. And when the trash people came out, they told us we're not picking this up. And it was the other part of the root of the tree was still over there, and Alabama Power Company cut it up and put it over there, or said to put it up. It was eventually picked up, but I'm saying there are instances where there is absolutely no doubt whether or not it's a storm-related debris, and the city workers still didn't pick it up. And on the other one, I got John Peavy involved, and it was 2 trees. One fell on one house, one fell on the other house. They cut it off the house, put it down. They wouldn't pick it up, and finally they picked it up. So I think we ought not to be in the time of emergency. We ought not to be treating our citizens like that when there's absolutely no doubt whether or not it's storm related. We ought to be picking it up and not out there telling our citizens we're not picking it up. We ought not to be putting them through that.
Okay, I'm not familiar with those stories, but I'll talk to Colonel Lapp about getting with John, and we'll determine what we need to do going forward.
Okay.
Well, since this is Mayor's questions moments, I want to throw mine in very quickly. I inquired of the administration last year during the Mardi Gras season about my neighbors along South Washington Avenue who were being ticketed by our inspectors because they were allowing people to park in their yards and didn't have a business license. And I was told at that point that practice was cease and desist. Well, I've gotten 7 or 8 neighbors who are irate with me since I've come home. They have come to my front doorstep with tickets in their hands to come to court over getting a ticket for allowing people to park in their front yards. And so I'm glad Mr. West is there. Mr. Mayor, I'm asking you all to investigate this. I told him I would bring it up in today's meeting, and this is my way to do it. investigated. And Mr. Arledge, I would like a ordinance created post haste that would disallow this practice in the city of Mobile. Because it's ridiculous that these persons from finance would be out issuing tickets in the middle of the night to private homeowners over 5 or 6 cars being in the fronts of their yards. And we've got gas stations and other businesses that hadn't paid us a dime in city taxes since I was a little boy. And they hadn't gotten a dime from them, but they're gonna worry the people on South Washington Avenue. And those folks are at their wits' end, and I'm at mine as it relates to this issue. And I assured them I was gonna bring it up today. Mr. Mayor, I know this is not, I'm sure you looked into it, and somebody under you said that they were gonna take care of it. Well, they did not do it. I'm not pointing the finger at you or at Paul West, but somebody is writing these tickets and causing disturbance along peaceful South Washington Avenue, and we want it to come to an end.
All right, I'll check on that. I don't recall, I kind of recall some of that conversation, and
That's right. This has come up every year. But you could help us out, Mr. President, by telling the mayor and me who told you that this would be taken care of.
You and Mr. West?
I don't think that, with all due respect, I don't think that was the case, but we did conduct an investigation. We'll have to retrieve that paperwork, but we will make sure that you get a full report.
Well, with all due respect, Mr. CFO and Chief of Staff, I can almost remember the date and the time and the smile you had on your face when you said it. And so if you could get me that report, I would certainly appreciate it.
We will do that.
Yes, sir. All right, I guess we'll see each other. It's not too far from 10:30. We'll see each other in about 6 minutes. All right.
So I will only be in that meeting for about 30 minutes or 25 minutes, because I'm going to have to be tuned into what the governor's doing, okay?
Well, we need to make sure we know what we're doing with that. We have
Right.
talked about getting through our agenda within a half hour so that we can recess and watch the governor and then come back and reconvene. So if that's what we are going to do, we need to set a time specific to reconvene and make sure that everybody agrees to get through the agenda within about 30 minutes.
We've had a lot of discussion today around these various items. I would hope that we could move expeditiously through this agenda. Fred, you're on. Fred, you're muted. That's good. Don't bother with it.
Stay that way.
Okay, well, I don't think we need to reconvene. I think we can get through the agenda in time.
If we can get through, that's great. But if we can't and we need to recess and reconvene, we need to make sure we have a time so that everybody rejoins at the same time.
Let's just try to get through the agenda and then we can adjourn.
That's good for me.
No announcements, yeah.
Yeah, no announcement.
Mayor's office. I'm serious. It's our meeting and we got to get it done. All right. Are we gonna close out and come back?
No, we only got 5 minutes. We might as well leave it going.
Okay, so.
I mean, I got
Mr. President,
and I'll be back by 10:30.
Yes,
Well,
I'll be back.
The live stream may turn off though, so that they can have 2 separate recordings. I don't know what they're doing.
Madam Clerk,
Yes, sir.
we just leave it on? It's the live stream continues and everything?
No, I'll cut it off. I'll stop it and start back.
Okay, but are we gonna have to all sign back in?
No.
Okay. I'll see y'all in a few minutes.
All right, good day.
all right. Man, that was a workout.
I'm gonna make some more coffee. I'll be right with y'all.
That one made my day. You know,
We're missing Gina and the clerk. Here we go.
How's that?
do we have any, I know I have two for a moment of silence. Do we have any more? Well, Councilman Richardson, you gonna say something about Miss Ware, since she was in your district?
Well, last week,
Sir?
we didn't talk about her last week.
I thought we did.
Did we?
No, we
Miss
didn't.
Ware?
I thought she passed since Tuesday.
Yes,
Well-
okay.
No, we didn't.
Yeah.
What are we waiting on?
Are we ready?
Yeah,
Really?
I don't have a gavel here, so. Just-
Okay. Okay, I'm gonna start the live stream. Oh crap, hold on. Hold on. And, we do have the chief here also, to give it, a report, and I'll call him doing communications from the mayor.
So will we have any other communications from the mayor?
I
One-
don't,
The only additional communication, really, there is no additional communication. Everything is, COVID-19 right now and waiting on the governor's order, and then we'll regroup and press on.
okay.
Okay.
So, in 3, 2, 1.
Want to count over again?
No, okay, this is not working properly with the live stream. I'm trying, again, I'm trying to do both.